Welcome back to the American College of Surgeons Bulletin Brief from the Front Lines, Surgeons' Voices. With me today is Dr. Kelly Hunt. Dr. Hunt is the chair of the American College of Surgeons Cancer Research Program, and she served in that role for 7 years. Welcome, Dr. Hunt.
Thank you. Thank you. Good to be with you.
Good to have you with us. I've had the opportunity, the privilege of interacting with you in many of the cancer programs over the last several years, and very impressed by what you've been doing with the cancer research program. But I'm not sure that all of our viewers and listeners are aware of that program. So perhaps we can start out by telling everybody about the ACS Cancer Research Program.
Yeah, sure. So the Cancer Research Program was built from the collaboration between the NCI cooperative groups. The American College of Surgeons Oncology group was a standalone group, but back 10 years ago now, it merged with the CALGB and NCCTG to form the Alliance for Clinical Trials in Oncology. And through that merger, the American College of Surgeons developed the program, the Cancer Research Program within the Alliance, to help largely with clinical trials, but it's grown into a much bigger program. Now we actually have several committees that focus on operative standards. So Cancer Care Standards Development Committee. We also have the Dissemination and Implementation Committee, which is really focusing on disseminating clinical trials information and implementing clinical trials into practice. And then also, as you know, the newest cancer program, the Cancer Surgery Standards Program, is based on the operative standards for cancer surgery, putting that into practice, into the Commission on Cancer accredited programs, and also focusing on synoptic reporting as a new tool to help with being certain that standards are documented appropriately within our operative record.
Thanks very much. And again, perhaps not everybody is familiar with the technical standards and or with the synoptic reports. So I'd appreciate if you could tackle each of those in turn and tell us a little bit about the history of each one and where we stand, future plans.
Yeah, so the operative standards for cancer surgery the first volume was published in 2015. And what the idea was, Heidi Nelson had this idea that, there are critical elements for each operation that we do in cancer surgery. And so what she did was she brought together a group of surgeons, and this started within the Alliance, but included people from the other NCI-funded cooperative groups and other surgical societies, brought them together. And what we did was took 4 disease sites. It started with breast cancer, colon cancer, and pancreas cancer and lung cancer. And what we did was we did reviews of the literature, looking at different operations and the data that was there to support critical elements. The critical elements of an operation are those that have an impact on oncologic outcomes, whether it's survival, quality of life, and other parameters that we and our patients care about. And so the critical elements of an operation are listed within the operative standards for cancer surgery. What we found was that within each disease site and within each operation, there were also elements of surgery that were more controversial. So we called those the key questions. These were areas of controversy where we didn't have enough data in the literature to support doing things in a specific manner. But so those key questions are really what we're now looking to build clinical trials around, to try to answer those questions and in a standardized format. So that's the Cancer Care Standards Development Committee within the Alliance and within the ACS Cancer Research Program is largely focused on these operative standards. So after volume 1 was published, we then set out to tackle a new set of diseases. And so volume 2 covers 5 different disease sites, including rectal cancer, thyroid, and several others. And volume 3 is covering some of the more rare diseases, such as soft tissue sarcomas and peritoneal surface malignancies. And volume 3 is actually in production right now.
Thanks very much. And they are great volumes. And I know we've had courses about them, sessions about them at the annual Quality and Safety Conference, and they're getting around and distributed to many people around the world. So that's part one. And then part two, in terms of standardization, just like the steps, which, as you say, impact outcomes, survival, recurrence, quality of life, there's the synoptic report element to ensure that we're capturing the right details. And perhaps you could give us a little bit of details about the importance of synoptic reports and where the ACS cancer programs are going.
Yeah, so this idea actually was also birthed out of the Cancer Care Standards Development Committee, because what we found was that in doing clinical trials, when there are certain elements that need to be reported for a trial, sometimes in going back to operative notes that were in narrative format, we weren't able to gather the information that we needed. And so we couldn't really tell in a lot of cases, everybody does their narrative reporting a little bit differently. And so the idea was that we would format these operative standards in a synoptic format. So that's what the Cancer Surgery Standards Program has been focused on over the last year, is developing the synoptic reporting that can then be incorporated into the operative record, so that when anyone looks at the operative note, they can see if the standards were followed, and makes it easier for not only for us for clinical trials documentation, but also for our other multidisciplinary partners who look at our operative notes when they're instituting adjuvant therapies after surgery, and they are trying to see what elements were completed and what weren't. And again, so narrative reporting is just really not very useful in most cases. So the synoptic format has been used by our colleagues in Canada for many years, and has been shown to be a very accurate way of reporting the operative record. So each element that you want to record has a specific response. And so it actually is a lot faster than narrative reporting. It's more complete, it's more accurate, it's more efficient. And so it's actually really a good thing to move towards synoptic reporting for all of our operative reporting. But right now we're focusing on the surgical standards from the operative standards for cancer surgery. We're focusing on getting those into synoptic format so that they can be added to the operative note for any cancer operation.
And as you know, we've been employing the synoptic operative report. It's one of the standards in the National Accreditation Program for Rectal Cancer, and the dot phrase NAPRC will bring up, at least in EPIC, it will bring up the synoptic report, which Arden Morris at Stanford and her group helped develop. And also put in a pitch that the pathologists and radiologists have been doing this for a long time, and it makes it very easy, for what I do to look and see what's the circumferential resection margin or the like. But not to get too much into the synoptic report. Let's get back to what you're doing with the upcoming ACS Annual Clinical Congress, where very few of the originally planned didactic courses are going on, and these didactic courses had to be reduced in time from half a day or a day down to a matter of hours to accommodate, and yours was one of the very few picked, the technical standards for cancer surgery. Maybe you could enumerate on what participants should expect and why people should sign up for that program.
Yes, thank you. And the title of the course, Technical Standards for Cancer Surgery Didactic Course, Bringing Evidence into Practice. What we found was that we published these operative standards manuals, and we've gotten a lot more uptake, and especially now that the Commission on Cancer has adopted 6 of the operative standards into its accreditation standards. And this is going to be implemented in over 1,500 institutions in the US. But what we found is that in doing this, it's not as simple as just asking everybody to start incorporating that into their operative record. There's a lot of education that needs to go on. And so what Matthew Katz and I did was to put together this course with Amanda Francescotti from the ACS, focusing on the transition from evidence that we use to develop the operative standards toward the day-to-day application of the standards in surgical practice. And so the course has several components. They're going to be pre-recorded talks. As you mentioned, it's going to be shortened from what would have been a full day course to just a couple of hours, but there are going to be some pre-recorded talks by Sandra Wong and Tom Aloya that first focus on the value of care and data supporting standards development. Carl Villamoria is going to talk about how surgeons can use operative standards and outcome metrics to improve surgical quality. And Elizabeth Grubbs is going to be talking about how the operative standards can be an important part of education for surgical trainees. And also by focusing on adherence to evidence-based standards, surgical trainees can enter the workforce with strong, not just strong technical skills, but also strong skills in terms of documentation and quality care. So we're then going to have some interactive discussion, and Judy Bowie, Fabian Johnston, Nicole Lopez, and Heidi Nelson are all going to be participating as moderators of that interactive discussion during the course. So I think it's really going to be a great educational opportunity to learn how to take technical standards from the theoretical constructs to fundamental components of surgical practices.
Very exciting. A lot of information being packed in a couple of hours, and congratulations on having one of the few programs that's actually going to be held this year, which I think really attests to the importance of what you and Matt are doing and the rest of the group with the technical standards and with the synoptic reports as well. Besides for surgical oncologists and people who do a lot of cancer surgery, are there others who should attend? I mean, for example, residents, fellows, people who are only sometimes involved with cancer. I mean, is it worthwhile to attend the course?
Oh yeah, thanks for asking that. I think certainly this is the operative standards for cancer surgery. It's how we develop this. But as I see it, I think it's going to be important for all of our operations in surgical practice. And so, as I said, our Canadian colleagues have been doing synoptic reporting for many years for all of their surgical procedures. And I think that it's the way forward. So a lot of the things that we're speaking about in the course are around, as I said, around value and quality care. And that applies to, of course, any of our surgical fields. So I think it is especially some of the work around education. Trainees could really benefit from attending the course, whether they're residents or fellows. I think it will be of interest to them.
Fantastic. Well, I look forward to seeing the results. I'm sure it's going to be outstanding course, knowing the quality of work that you've been doing and Matt's been doing in this arena. I thank you for sharing these concepts with us today, and look forward to actually meeting in person at some point.
Yeah, that would be great. Thanks.
In the meantime, stay safe.
Yes, you too. Thank you.